syndrome and other health problems. And also joining us today is Janet Vohs. Janet is the Federation, actually she is with the Federation, she's not the Federation, I imagine there's other people, right?
The entire Federation.
For Children with Special Needs, a national resource center for parents of kids with disabilities, and she's also the mother of a 25-year-old daughter with cerebral palsy. Janice, thank you so much for coming to Real Life today. I appreciate it.
My pleasure.
Let's talk a little bit about your daughter Jessica, who I understand is in the audience today.
Jessica is here today. She came at the last minute. I thought she was going to be teaching today. She's a teaching assistant at one of the public schools in Brookline, in Dorchester, in Boston.
My mouth is not working real well today either.
And so anyway, she had did have the day off, so she came on over to be on the set with us. She's here with her assistant who lives with her. And yeah, so I work at the Federation. Jessica's here. She's pretty excited. I can see her squirming in her seat. She's with Shawnee, who's her roommate. And I guess, let's see, what else?
Well, actually what I think I'd like to ask you in terms of being a mom raising a child with special needs. Yeah. We've been talking to Camille and the way that Camille has raised all of her children. And I'm wondering how that may either coincide or differ from your approach or your sense of taking care of kids. Can you talk a little bit about that?
I'll tell you, I think a lot of different things about that. I think that right now we hear a lot of rhetoric in this country about family values. And I think
right now, especially with that political process.
Very, very much talk about that with the political process. And yet, how much real valuing of families do we see? In my job, I'll talk personally about my life with Jessie in a minute, but I want to say also professionally, at my office, we are constantly working with parents who are in tough situations, having to figure out how are they going to make it with their kid, and what are they going to do with no health insurance, not enough funds to really pay for the medical equipment or the kind of special therapies that the kids need. And so many parents have had to give their children away, relinquish custody of their children, to have their children be in an institution in order to get the kind of help they need. And our country has a policy bias in favor of kind of congregate, institutionalized care. It's definitely changing gradually, but the few supports that go to actual families that have the children are meager compared to what you can get if a child goes to an institution. Jessie was younger. She lived with me.
Let me stop you for a second. Are you saying that you think of what Camille does as kind of institutionalized care? I'm not sure if that's what I'm hearing.
Well, I think that, do I think it's institutionalized care? I think that it's congregate care for sure. Now, whether to say the word institutionalized in this day and age when what we have in our mind possibly are things like Willowbrook or really horrible situations, which is our history of institutions, would be definitely overstating the case. But it is congregate care. That was interesting, just the comment about that her children have their own bedroom and their own place to stay so that they know that that's, then they have as normal a life as possible. And I would want that for every child, regardless of a disability. There's nothing inherent in having a disability that makes you more predisposed to sleeping in a bedroom necessarily with 20 kids than having your own room and your own teddy bear and your own. So there's nothing.
Boys, it's the better kind of sweeper, the real McCoy. The gloves are new and thicker now. The lip and lock pockets are deeper.